आप सुन रहे हैं EBC रेडियो WWTR 1170 AM ब्रिज वाटर, आपकी चॉइस।
EBC रेडियो आपकी चॉइस।
Namaskar and welcome to EBC Radio 1170 AM Aapki Choice, and I'm your host Alka. I invite all my lovely listeners to join us for a very special health education series which is brought to you by RWJ Barnabas Health. We bring you conversations with leading doctors and health experts. Together, we'll explore simple tips, important guidance, and the latest updates to keep you and your family very healthy. So today our topic is breast cancer in the health education series, and the doctor to speak on this topic is going to be Dr. Manpreet Kohli. Dr. Manpreet Kohli, she is the director of breast surgery for Monmouth Medical Center and Robert Wood Johnson Barnabas Health Hospital. Dr. Kohli is a cancer liaison physicians for the Commission on Cancer, recognized locally and nationally for her work in the field of breast cancer. She is an early adopter of new technology and created the region's first lymphedema prevention program utilizing bioimpedance and spectroscopy and MAC trace, and helped launch the state's first Paxman scalp cooling program to help prevent chemotherapy-induced hair loss. Dr. Kohli was the first in New Jersey to become certified in hidden scar breast surgery in 2015. She was named American Cancer Society's Healthcare Professional of the Year in 2019, and 2021 she created the non-profit organization which is called I Pink I Can to help provide equality in breast cancer care regardless of financial status. This has helped remove barriers to care for many women in Monmouth County after a breast cancer diagnosis. She strives to provide the highest level of comprehensive and compassionate care to set patients up for a long and successful survivorship. Dr. Kohli received her medical degree from the Kasturba Medical College, Manipal University in India. She completed her surgery residency program at Monmouth Medical Center and completed her breast surgical oncology fellowship at Mount Sinai, St. Luke's, Roosevelt, and Beth Israel Center in New York. She is also a member of the American College of Surgeons. So with that, let's welcome Dr. Kohli on EBC Radio. Dr. Kohli, how are you doing?
I'm great. Thank you so much for having me and for such a wonderful introduction.
Well, I'm so honored to have you back again on the radio, and it is a privilege and honor to be speaking to you today here.
Well, it's a wonderful time to come back, especially with October being Breast Cancer Awareness Month.
Yes, doctor. As you know, the topic is breast cancer. So let us talk a little bit about that, why it is so important for women to understand the importance of screening for breast cancer.
Well, it's hugely important to be aware of the risk of breast cancer that all women have. And when somebody waits to feel a lump, they're often finding this lump when it's a higher stage. If a patient is going for a mammogram when they don't have any lumps or anything that they can feel, sometimes we find things before you can feel it, and if we are, we will be finding breast cancer at an early stage when it's less aggressive with fewer treatments potentially. Mm-hmm. Sometimes we find things even before they're cancer and have an opportunity to prevent cancer from developing. So none of that is possible without going for screening imaging. That's so important.
Okay, so now the next question comes that at what age should women start getting a regular mammogram, and how often should they get screened?
Certainly all women should at the very least have a mammogram at age 40, and they should continue this once a year. When they stop is really a matter of when will we stop wanting to do something with the results of that imaging study. As long as a patient is healthy, can tolerate a mammogram, and tolerate any treatments I might be able to offer, which tend to not be so aggressive, then we continue to screen. What is really important, though, is sometimes there are women that benefit from starting before age 40, and those are patients who might have had a family history of breast cancer or some other risk factors that make them at a higher risk than the average person. If that's the case, we want to start screening earlier than age 40 and using maybe some additional tools, not just mammogram, but maybe MRI.
Okay, so somebody who has a family history, they should be really seeking to go for the screening earlier, right?
Definitely.
Yeah.
So family history is a really important thing to keep track of. But what I will say, most people are very surprised to hear that most breast cancers happen in people that have no family history. And 85% of breast cancers happen in people that have no history in their family of breast cancer. So it often, even though it is very important, sometimes we have a false sense of security if we don't have any family members that have had it. And that's sometimes why I see women not go for screening imaging, because they think that they're not going to get it because no one else in their family has.
Yeah, that's something they should not be following. Of course, if you have a history, it is more important to be more alert and talk to the physician. And if they recommend them to go for early screening, they should. But if you are not having history, as doctors say, I think still we all should go after age 40 for every year screening, right?
Exactly.
Okay, so doctor, now what are different treatment options for someone recently diagnosed with the breast cancer?
Treatment options are improving every single day, and it's the care of breast cancer is changing at such a pace that we really have to be very aware of the latest research updates, and it's amazing to see how the process has improved. So it's a much less aggressive course. Patients who are treated for breast cancer, we're really aiming specifically at the cancer and trying our best to not have as much collateral damage to the individual. So really targeting the cancer with few side effects. So we have so many different options that we really tailor the plan based on the person right in front of us and their specific type of cancer.
Well, doctor, as you said, the care, like, you have done the study and research that with the chemotherapy, the hair loss and scalp, so you
Cooling.
are, so scalp cooling that I've heard from so many people, like, when they go for chemo, they lose their hair. So
Right. And so I think it's really a scary thing when people hear the word cancer, they immediately envision themselves as very sick, very ill, without hair, and the truth is many breast cancers don't need chemotherapy. And if somebody is in need of chemotherapy, which in that case is really considered life-saving treatment, it's very sad to see 1 in 12 women decline chemotherapy because they're worried about hair loss. So the way that we address that is with scalp cooling, and that does a great job of preventing chemotherapy from having as much of an effect on the hair follicles. And so it preserves identity. You can still get excellent treatment and still look like yourself without people knowing if you're getting chemotherapy and saving your hair. And chemotherapies are not as aggressive as they once were. Some regimens don't have hair loss. And we even have some really new groundbreaking options where we're doing immunotherapy using the body's immune system, working on vaccines for breast cancer. It's really unbelievable to see what is on the horizon for breast cancer care.
So science and technology is really, moving so fast, which is helping the patients, right?
Oh, absolutely.
Yeah. So, Doctor, can you let me tell again my friends who have just joined EBC Radio? We are in talks with Dr. Manpreet Kohli, and our topic today is breast cancer. So, please listen carefully. They're very, very good information Doctor is providing us. So, Doctor, can you talk about the prevalence of breast cancer in the South Asian community and provide any advice to this population?
Oh, absolutely. As someone of Indian heritage myself, I've really seen how there are misconceptions. And, you know, culturally, this isn't something that was always so readily shared. People are very private sometimes and don't want to burden other people with, you know, their health problems. And sometimes we aren't aware if there is a history of breast cancer in the family, or it was once very taboo. But the truth is, breast cancer affects all ethnicities. And in Indian women, it is the most common type of cancer. So it was previously cervical cancer, but now breast cancer is the most common type of cancer in Indian women. What's unfortunate is because we don't have as high a level of awareness, unfortunately Indian women get diagnosed at a later stage with more advanced cases. So over 70% of Indian breast cancer cases are diagnosed at a more advanced stage, and that can really reduce the survival rate. So it's so important for us to all go for our screening imaging to give us the best chance of early detection. And if caught very early, breast cancer has a very high 99 to 100% survival rate when it's caught at its earliest stages. So, you know, I really implore all of my counterparts to be more aware and, you know, and think of things that we can do to protect ourselves. You know, we want to make sure that we're eating healthy. Obesity is a risk factor. Having a poor diet, really keeping ideal body mass index, those are things that are very helpful. Staying active. These are things that every doctor will say are beneficial, but especially in breast cancer care, it can really help reduce risk if you're taking care of yourself.
So lifestyle is extremely important for every individual, actually.
Absolutely.
Yeah. So now, Doctor, the last question I would ask you is, why should listeners seek cancer care at the NCI-designated comprehensive cancer center like Rutgers Cancer Institute and Robert Wood Johnson Barnabas Health?
Well, NCI-designated cancer centers are not common. It takes a lot to establish that distinction. This means that this is a cancer center that has access to the latest clinical trials. And sometimes people think of clinical trials as experimental, but what's true about that is it's not experimental on the individual. It's giving access to the latest and greatest treatments before anyone else has them more widely adopted elsewhere, and proving that they're a better option than the previous ways that we were treating cancer. So I think that that's a really important thing to remember, is having not just awareness that you need to go for your imaging, but if you are diagnosed, you want to have access to the latest, greatest care, because that's how you get through it with minimal side effects and the longest, long-term outcome with a good prognosis. So I think it's a very, very important thing to make sure that you're aware of where you're getting cared for. Are your breast imagers ones that only do breast imaging? Are your surgeons ones that take care of many things, or are they specialty trained in surgical oncology of the breast? You know, these are things that do matter in the end. So it's, I think all of us thankfully have access to this because we have so many locations throughout New Jersey. So, and we have a centralized phone number now where it's one phone number and you can be connected to physicians in your area that are affiliated with our NCI-designated cancer center at Rutgers. Robert Wood Johnson.
Wow, that is really amazing because as a patient, you don't need to run around in different places. It's all in one place, right?
That's right. That's right. All you have to do is call and show up, and the rest we take care of.
That is great because people sometimes, when they come into this kind of situation, they just try to run far and they think that could be the best solution or the best place to get treatment. But it is right in your, corner, in your backyard, I would say, So
I think many decades ago, people did have to go far. They would have to go to New York City or Philadelphia. And now what we're seeing is we've brought that level of care or even a higher level of care close to home. And then you don't have those barriers of, the transportation issues or sitting in traffic or stressing if you're going to miss an appointment because your drive will be 2 hours. All of those things add more burden to something that's already pretty difficult to go through.
Yeah.
So we really want to make it as easy a process as possible because we know it can be difficult and stressful.
And now they have a beautiful new hospital in New Brunswick, that Maurice and Cheryl, right?
Oh, yeah. It's beautiful. And we have another new cancer center, the Vogel, which will be developed here in Monmouth County on the previous Fort Monmouth site that we're aiming for end of 2026 to have. You can see it being constructed if you drive down the parkway. It's beautiful.
Very nice. So it is Robert Wood Johnson is really bringing the best treatment for cancer and all other kind of diseases. And I think people should consider there and contact them and see what best treatment they can get. So, doctor, before I let you go, what is the one message you would like to leave for our listeners about a breast cancer awareness and prevention?
Breast cancer isn't as scary as it once was, and I think that's really important to remember, that fear has really held women back because they're scared of what if they're diagnosed. But care has improved so much that it is certainly inconvenient, but in most cases, if caught early, this is extremely treatable with very, very few long-term side effects and a great, great prognosis. So rather than letting fear stop you from going to get the imaging you need, go and get a mammogram and get the reassurance that you're in the clear. And if you're not, at least you've done your job to catch it as early as possible, and, we can take care of the rest.
Very, very good message for our listeners. And screening and catching the cancer at the earliest is the key. And
absolutely,
yeah, screening is the way you can do that. So thank you, Dr. Manpreet Kohli, for sharing such a valuable insights with our listeners today. We truly, truly appreciate your time and commitment to spreading awareness. So friends, remember, your health is your wealth. So do go for screening, and hopefully there won't be any cancer. And if it is there, it is caught early, and there are so many great doctors like Dr. Kohli, and they can treat you. Thank you.
Love it. Thank you so much for having me.
Thank you, doctor. And this segment is again brought to you by RWJ Barnabas Health, and we are grateful for them to support this. Thank you so much, doctor.
Thank you. Take care.